Hey, this is Chris Dewey with May River Medicare. And what happens if you're under 65? You're on disability. You won your disability case. You waited your 24 months on disability. You get your fancy red, white, and blue new shiny Medicare card. What then? Well, I can tell you what you can't do. For people 65 and over, you can get a Medicare supplement. In nearly every state, the states have the rights not to offer a Medicare supplement, which pays everything Medicare doesn't, for a monthly fee. That's not an option because most states, if you're like 50 on disability, and they do offer supplements, they're going to charge you $500-600 a month, which is a large portion of your disability check. So it doesn't make sense. How do I know all this? My girlfriend of 9 years is a disability attorney. Okay, so every single day I hear her on the phones trying to help folks that are very, very ill, people that broke their back at work and then couldn't work anymore, people that have schizophrenia, people that have COPD, congestive heart failure. These are the folks that I work with. It's probably over 60% of my clients are on disability because, again, I have that partnership with my girlfriend who is one of the best disability attorneys out there if you need her help. So you can either get original Medicare and just stay on it. Hey, you know what? I don't need anything else. You do have to get a prescription drug plan. If you don't, you get penalized. So you can just have original Medicare and a prescription drug plan, or the only option, the better option, is to get a Medicare Advantage plan. What that means, with original Medicare, you got Part A, hospital, Part B, everything outside the hospital, and a drug plan. Problem with just that is you're going to pay 20% of everything. Medicare only pays 80%. You're going to pay 20% of outpatient surgery. You're going to have a Part A deductible around $1,600. Every time you go to the hospital, you got to pay that. So this Medicare Advantage, what it does is it takes your Part A, Part B, and your drug plan and wraps it all into one card. It's called a Medicare Advantage plan, or Part C. That's what we need to do, okay? That's where we're going with this. So basically with Advantage plans, your costs are going to be a lot less. You're going to have a copay for hospital, but it's not going to be 20% of who knows what. The Medicare Advantage, they may cover excluded services. What that means is we can get you some dental, we can get you some vision. Let me look at the different programs. I'm licensed with all the companies. There's restrictive networks. But when you're on disability, you want to get the most bang for your buck. You don't care if there's a network because you want the lowest possible copays. You want the dental, you want the vision. So you want to just make sure, use an agent like me, I'll make sure your doctors are in network. If not, we'll find an Advantage plan that does have your doctors in network, all right? With Advantage plans, you may need a referral. I typically go with PPOs, sometimes HMOs if they have a good network. Get you some good dental and hearing. Okay, let's look at costs, Advantage plan costs. So real quick, but before I do that, the number one thing that 90% of Medicare agents don't do with disabled clients is the very first thing we're going to do is we're going to look at your income, all right? If you make less than, actually, they had $20 plus 65, but let's just round it off. If you make less than $1,500, if you make less than $1,500 a month, you need to call me and let us help you, because what we can do, if you look over here, there's different levels. If you make less than $1,500, you're a qualified individual. What does that mean? That means that Part B premium's paid for you. $148. Do you realize they take $148? As soon as you go on Medicare disability, they take $148 out of your check unless you apply for a Medicare savings program. All right? And the Medicare savings program just simply means you make less than $1,500. If you make less than $1,500, we can get you on, so they pay your last 3 months of $148 a month, and then going forward, $148 goes back into your check. Guys, I can send you the link. You can fill it out easy enough, or we'll do it for you. We'll have one of our assistants do it for you, okay? This is huge because once you get QI, once you get that, you can get an Advantage plan, and it's only available, and hardly any agents even know this, honestly. They do more harm than good with disabled people. Right here, you have to have either SLMB, QMB, or QI. That's these little fancy things here. Basically, it's your income level. All right? Once you get that, if you make less than $1,500, I get you a plan Your outpatient surgery is going to be really, really cheap. You're going to pay no copays to your doctor. At the most, you might pay $15 for a specialist. All right, you'll pay between $0 and $325 for hospital for days 1 through 6. Hate to tell you, but if we get you in a zero premium plan and you're worried about this $325 a day copay, give us a call, because what we'll do is we'll get a little hospital plan in there that pays like $400 a day for days 1 through 6. $20 a month. You never have to worry about a hospital copay again. All right, a lot of different things we can do with these Advantage plans. But the big thing is look at the summary of benefits and go through and look at what things cost. All right, outpatient surgery, 0, or it could be 20%, depending on your income level. I can help you with that. All right, and most of these plans will give you some dental. I like this one because it gives you $2,000 in dental. All right. Okay, guys, so the other group of disability, most of my disability clients fall in these 3 groups. Most of them do. So if you make less than $1,500, you get what's called a qualified individual status. It's partial Medicaid. So if you make less than that, you fill out a 10-minute application or let us help you, and that'll pay your Part B premium, which is $148. That's what they take out of your disability Social Security check every month. They take the $148 out. You probably noticed, I just got a decrease when you first went on Medicare. It's because they take that out for the premium. So this other group is SLNB. It's the same thing as the QI. You have to make less than $1,308 to qualify for that. But it's the same thing. It pays the Part B premium. It pays retroactively the last 3 months that you paid for the $148 Part B premium. But the big one right here that I want to go over is many people, I'd say probably half my disability clients are under $1,100 a month. And what that means is in your assets, they also look at your assets. Your assets have to be less than about $8,000. Okay? So if your assets are less than $8,000, so let's say you just won your disability case, you have $14,000 in back benefits, you pay off some bills, fix your car up, you got a little bit left over. That'll go below the $8,000 real quick. You apply for these programs. So with SLMB, the only difference is you might be able to get a Medicare Advantage plan that only works with SLMB, and you'll get much lower copays, less cost sharing, more dental, vision. I keep track of this every October and look at the new plans. But the big one is this qualify. If you make less than $1,100, what you can do is you should automatically be on it. But if you're not, we can apply for you. Pays a $148, but the big thing is it pays everything. So if you get a Medicare card, you get a Medicare card. If you make less than $1,100, you get a Medicaid card. And here in South Carolina, they call it Healthy Connections, but it's Medicaid. So Medicare pays first. Whatever's left, Medicaid pays. You pay nothing. But the biggest thing is, if you have those 2 cards, you make less than $1,100, and it's called QMB. You got the Medicare card, you got that Medicaid card, the state card. It says Georgia Department of Health in Georgia. It says something else in Michigan. So, but the point is, you got those 2 cards. Don't just take the drug plan. Get them dual. Get a Medicare Advantage plan. It's called a dual plan. And if you have a Medicare Medicaid card, and we check your doctors and are all in network, and there's great networks with Humana and Aetna and some other companies. But so let me show you right here. Once you get Medicare and Medicaid, you can go on it's called a special needs plan dual eligibility. Dual means you got both Medicare and Medicaid. So as you can see, everything's free like it would be if you just kept those 2 cards. But here's what you get. You get stuff that if you just have Medicare, Medicaid, and a drug card, you don't get. You get $400 in glasses, all right? You get everything 0. Drugs are, between 0 and $370 would be the most. But actually, since you're on Medicaid, everything's free. But I want to get down to dental, all right? Dental benefits. Let's go down to that. Okay, you get $25 in the grocery card. Every single month you can spend $25 at the grocery. You get $200 every 3 months for over-the-counter stuff, eye drops, vitamins, whatever medicine, like cough syrup. You get a help, I've fallen, I can't get up, emergency response system. Love that commercial. Hey, you need a wig? You've been going through chemo? Get a $500 wig. Silver Sneakers is big. Silver Sneakers is you get free gym memberships all across the country. Anytime Fitness. I mean, and I know where we are. There's 4 or 5 gyms that you can go to in Savannah. You got all the YMCA's. The dogs are barking, and I'm still powering through this. So you get dental. You get the $200 a month. You get. I was just looking for the dental. Okay. Here, $3,000 in dental. $3,000 in dental. That includes cleanings, comprehensive, set of dentures. You need a new set of chompers? It's $0 for dentures. $0 for x-rays. $0 for all this stuff. Okay, guys? Okay, real quick. Let's look at this. These are the MSP, the Medicare Savings Plans. We talked about the different types. So the big thing is I had a guy, he was making like $980 a month. He had Part A. He didn't even get Part B because he didn't have enough money to pay the $140, the $148. So he just said, I just can't go to the doctors. I can't afford Part B. Talked to him, applied for the Medicare Savings Plan. He ended up getting actually QMB. Not only did he get his Part B back, he was able to get it back right that month when he applied and got the Medicare Savings Plan, the QMB. We got him in a plan with the thousands in dental, and he didn't want to get the Part B because he had a penalty. For every month you don't get your Part B within 63 days of when you're supposed to get it. If you decide not to get it, you get a late enrollment penalty. The government, and that's for life, and that can really add up over the years. And the last thing is with Medicare Savings Plans, okay, so you can get the Part B outside the enrollment period. Won't cost you anything. You won't have enrollment penalties. But the big thing is people who are approved for these QMB, SLMB, these plans we've been talking about, QI, these savings plans, they're automatically enrolled in the Extra Help program. We're going to get to that right now. The Extra Help program is a program that just drastically reduce your drug costs, pays your drug deductibles, just makes life a lot easier. If you have an agent that knows how to navigate those waters, get the Extra Help. Okay, so getting back to Extra Help, if you have a Medicare Savings Plan like Medicaid, QMB, SLMB, qualified individual, if you've applied for that and you get that, you automatically go on Extra Help. So what's Extra Help? Well, Extra Help is based on your income. If you make less than $1,630, you're going to get partial help. Huge help for people on lots of drugs. What that means is when it comes down to generics are $370, brand names are $920. With partial extra help, though, it's 15% of the plan, 15% coinsurance for the drug, or whatever the plan's copay is, whichever is less. But eventually that drops down to $370 for generics, $920 for brand names. Generics, if you just let me help you, I can get all your generics for free. Simple way to do that using the insurance company's mail order pharmacy. So remember, if you got Medicaid, you're automatically getting extra help. You know, if you're making $1,600, $1,700, in that from $1,500 to $1,700, we need to apply for extra help, big time. It's gonna bring your expensive drugs like Eliquis, Advair, asthma sprays, insulin shots like Novolog, Humulog. That's all going to be $920 for those brand name drugs, sometimes less. All right, so that's something we want to look at. And also, if you look right here, you get some benefits, extra benefits with Part D. A lot of people forget to sign up for the drug plan when they go on Medicare, and they end up getting stuck with a penalty. That penalty is for life. All right, it's for life. And the other thing too is, like I just said, you can change any time of year you want. If you got extra help, if you're getting extra help for drugs, you can change between January and March. Use up your $2,000 dental. Call me. I need more dental work done. We'll switch to a different company. Use their dental. Hey, Chris, I need some glasses. We'll switch to another company. I don't mind switching if it makes sense. It helps a lot of my clients who don't have thousands for dental to switch a couple times and use the insurance company's dental. And I work for you. I don't work for the insurance company. So keep that in mind. I'm a Medicare advocate. Like I said, my girlfriend's a disability attorney. Your needs come first. This is not about us selling you a Medicare Advantage plan. This is about us developing a long-term relationship with you over the next 10 to 15 years so we can help with your Medicare, your life insurance, whatever you need help with, all right? So the last thing I'm going to talk about real quick is, one of you might say, well, I'll just use somebody local, or I'll call the Joe Namath commercial, or I'll call a big call center with just hundreds of people on the phones. Here's the problem you're going to get. One of the biggest problems I have with Medicare Advantage plans, and if you were under 65 and disabled, I would not recommend an Advantage plan. You're much better off with a supplement. There's no doctors networks. You pay whatever, $100 a month, and pretty much everything Medicare doesn't cover is paid by the supplement. But you don't have that. It's not an option for people under 65. Here's what you're going to run into, guys. Denials. You're going to get drugs denied. You're going to get routine medical procedures denied. One thing you got to keep in mind, these are insurance companies. These insurance companies are, how do I say this nicely? They care about one thing. They're stockholders. They don't care about you, all right? So they deny millions and millions of claims every single year. Now, here's the good news. And we're talking drugs that are like Eliquis or, certain brand name types of insulin that only work for you. They'll deny that. If you don't have an agent or a disability attorney in your back pocket that's going to appeal this stuff, good luck trying to do it on your own. All right? Well, you guys already know. You've tried it. It's you need somebody that does this in and out, that knows how to fight the insurance companies, that understands the appeal process, that will help you send a pre-authorization form to your doctor to get those damn insurance companies to pay for the drugs that you need. So interesting is 75% of the time when you appeal a denial or you appeal or you fill out a pre-authorization form to get your drug covered, 75% of the time they overturn it and they give you what you need. It's just a money-making machine in an insurance company. If they can deny it, what they're hoping is you'll just go away. They're hoping you don't have an agent like me that's going to help you. That's what they're hoping. All right? So anyway, you guys have a great day. I have a special place in my heart for folks on disability. I deal with you guys all day long, every day. And I know it's not easy, and my hat goes out to you. I don't know how you guys do it sometimes. But anyway, we'll talk to you soon. Bye-bye.